Good morning. Welcome, everyone. My name is Melinda Shelby. I'm a member of the clinical team at Aegis Sciences Corporation, and today I will be presenting NPS trends in 2024. The following material is not authorized for reproduction without express written consent. Thank you for joining us for today's webinar. This is a brief educational webinar examining detection of NPS at Aegis Sciences Corporation in 2024. From this presentation, you will be able to identify various classes of NPS and the most prevalent NPS identified for each class, as well as identify trends in NPS detection. Those who missed the live presentation or would like to hear it again may find a recording of this presentation on the Aegis website, shown on the slide below. And please call 1-800-533-7052 if you need assistance accessing the recording. So NPS are a diverse group of synthetic substances created to mimic the effects of prescription or illicit drugs that are often used non-medically. There are various classes of NPS, including designer opioids, designer benzodiazepines, synthetic cannabinoids, synthetic stimulants, hallucinogens and dissociatives, and others. Now, NPS may change frequently as legislation to control specific chemical structures or classes of NPS is introduced. Now, once an NPS has been deemed a controlled substance, often new or modified, non-regulated NPS appear. And this remains a challenge for regulatory and enforcement agencies, monitoring institutions, clinical and toxicology laboratories, as well as for healthcare providers. Aegis offers NPS testing by class in both urine and oral fluid. Shown here are 2024 NPS order rates by class and by month. The designer opioids class was the most frequently ordered NPS class, followed closely by designer benzodiazepines, which was about 95% of the designer opioids. The NPS other class was the next most frequently ordered class at approximately 80% of the designer opioids. Order rates for synthetic cannabinoids and synthetic stimulants were very similar, about 67 to 68% of designer opioids, respectively. And the hallucinogen dissociative class was the least frequently ordered class, which was about 42% of the designer opioids. Now, when evaluating NPS data, it is important to consider that order rates may impact NPS detection and observed prevalence both within a class and between classes. For example, in August of 2024, there were approximately 15,000 more tests for designer opioids than in January. Additionally, the hallucinogen dissociatives class had the lowest positivity rates, but also had the lowest order rates. In order to lessen the impact of differences in order rates, the data presented reflects percent positivity based on the monthly order number. At Aegis, we have a NPS other category that includes substances that do not easily fit within other designated NPS classifications. This group currently consists of xylazine, medetomidine, phenibut, tianeptine, as well as BTMPS and phenylbutazone, which were added to Aegis NPS testing in December. Now, some of these compounds are not specifically NPS, but rather are veterinary medications that are emerging adulterants in the illicit drug supply. Xylazine is an alpha-2 adrenergic receptor agonist that's approved for veterinary use as a sedative with analgesic and muscle relaxant properties. It is not approved for use in humans and may cause unique withdrawal episodes and severe necrotic skin ulcers. The prevalence of xylazine and its metabolite in 2024 is shown here. Arguably, the most interesting story of NPS at Aegis in 2023 was xylazine, as its detection continued to increase from 2022, and it became the most prevalent NPS detected at Aegis in 2023, irrespective of NPS class. And xylazine continued to increase in 2024 and comfortably remains the most predominant NPS detected at Aegis. The prevalence of additional compounds in the NPS other category in 2024 are shown here. Like xylazine, medetomidine is an alpha-2 adrenergic receptor agonist and has been detected as an adulterant in the illicit drug supply. Unlike xylazine, medetomidine has been approved for medical use by the FDA and is available in both veterinary and human pharmaceutical formulations. Medetomidine and its metabolite were added to NPS testing in September of 2023. And in December of 2023, the Center for Forensic Science Research and Education, or CFSRE, issued a toxic adulterant alert for medetomidine. Now, throughout 2024, positivity of medetomidine and its metabolite in Aegis testing increased by 350 and 933% respectively. And 97% of the samples that were positive for medetomidine and or its metabolite were also positive for xylazine. Now, BTMPS, shown in yellow, is the latest emerging adulterant in the illicit drug supply. It is an industrial chemical that has been used in the manufacture of plastics and is reportedly a potent calcium channel blocker. BTMPS rapidly appeared in the illicit drug supply in August of 2024 and has already been identified as a public health concern. It was added to Aegis NPS other testing in December of 2024, and its detection that month was nearly that of phenibut. Phenibut, which is shown in the orange, is a synthetic form of GABA-aminobutyric acid, and it acts similarly to a benzodiazepine. Its positivity in December was increased 71% compared to that in January. Tianeptine, also known as gas station heroin, is structurally classified as an atypical tricyclic antidepressant, but at high doses, it has mu-opioid receptor activity. The FDA reported tianeptine products have been linked to serious adverse events, including overdose and death. In Aegis testing, tianeptine metabolite MC5 positivity, shown in the purple, increased by 33% from the first half of 2024 compared to the second half. Designer opioids include various subclasses of compounds such as fentanyl analogs, also known as fentanylogs, along with nitazene analogs, and others. The top designer opioids detected in 2024 are shown here. The most prevalent designer opioid, fluorofentanyl, is often detected with despropionyl fluorofentanyl, which may be either a metabolite or a process impurity. Now, fluoronorfentanyl, a metabolite of fluorofentanyl, was added to Aegis testing in April. For multiple years, fluorofentanyl was the most frequently detected NPS at Aegis among all NPS classes until April of 2023 when xylazine overtook it. In 2024, fluorofentanyl positivity increased by nearly 22% in the first quarter of the year and remained fairly steady until the fourth quarter when it decreased by 43%. Despite this decrease in positivity, fluorofentanyl was the second most prevalent NPS detected at Aegis in 2024, irrespective of NPS class. Despropionyl fluorofentanyl detection followed that of fluorofentanyl, but averaged approximately 75% of its detection level, and fluoronorfentanyl positivity was very similar to that of despropionyl fluorofentanyl. Shown here is the positivity of the nitazene designer opioids. Now, in 2019, there were class-wide bans on fentanyl-related substances in both the United States and China that impacted availability of this type of designer opioid. In 2022, we started to see a rise in detection of nitazene compounds, with 4-hydroxynitazene becoming the next most prevalent designer opioid marker detected at Aegis, followed closely by metanitazene. This trend continued in 2023, but changed slightly in 2024. So indesethylmetanidazine, a metabolite of metanidazine, was added to Aegis testing in April. Now, the positivity of this metabolite ranged from 134 to 238% of metanidazine positivity. And despite not being included in testing for the entire year, its annual positivity was slightly greater than that of 4-hydroxynitazine, shown in the dark brown. Thus, in 2024, N-dethylmetanidazine was the next most prevalent designer opioid after fluorfentanyl and its related compounds, followed closely by 4-hydroxynitazine and then by metanidazine. 4-hydroxynitazine has been identified as a universal metabolite for multiple nitazene compounds, including isotonitazine, metanidazine, etonitazine, protonitazine, and butanidazine. In Aegis testing, 4-hydroxynitazine has predominantly been detected alone or in combination with metanidazine, but it has also been detected with other nitazene analogs. Now, the next most prevalent designer opioid in 2024 was N-pyrrolidino 4-hydroxynitazine, which was added to Aegis testing in September of 2023, and it's shown in the dark purple. Its positivity fluctuated throughout the year. It's likely that just as 4-hydroxynitazine is a universal metabolite for multiple nitazene compounds, that N-pyrrolidino 4-hydroxynitazine will be a universal metabolite for the N-pyrrolidino form of those same nitazines. Now, of parent N-pyrrolidino compounds, the N-pyrrolidino 4-hydroxynitazine was most frequently detected with N-pyrrolidino metanidazine, but was also detected in combination with N-pyrrolidino metanidazine and N-pyrrolidino protonitazine, as well as with N-pyrrolidino etonitazine and N-pyrrolidino protonitazine alone. Now, the positivity of other fentanyl-related designer opioids is shown here. Designer opioids with less than 20 detections in the year were not included in the graphs. Now, of these other fentanyl-related compounds, valeryl fentanyl carboxymetabolite, shown in the dark blue, was the most prevalent and had annual positivity slightly less than the N-pyrrolidino 4-hydroxynitazine. The next most prevalent designer opioid was norcarfentanyl, shown in red. Detection of norcarfentanyl was one of the more interesting results in designer opioid detection in 2023, as its detection was minimal throughout the year but increased significantly in Q4. Now, in 2024, detection was highest through April, but then decreased and fluctuated at lower levels for the remainder of the year. Now, acrylfentanyl, shown in purple, and benzylfentanyl in periwinkle blue were the next most prevalent designer opioids in 2024. Both had their lowest positivity in Q1. Despropionyl bromofentanyl positivity, shown in the light blue, was opposite of that in that its detection was highest in Q1, significantly decreased, and was minimal in the second half of 2024. Now, methylfentanyl, which has 3 positional isomers, ortho, meta, and para, was newly added to Aegis designer opioid testing in December. In our testing, the ortho isomer, shown in green, is distinguished from the meta and para isomers, which are not distinguished from one another. In December, CFSRE released a public alert noting that orthomethylfentanyl, the newest synthetic opioid identified in fatal drug overdoses, is proliferating across North America. Considering only December designer opioid positivity, orthomethylfentanyl positivity was approximately 90% of the valeryl fentanyl carboxymetabolite and also 4-hydroxynitazine positives, which were same for that month. Okay, the positivity of top designer benzodiazepines detected in 2024 is shown here. In December of 2022, the DEA temporarily placed clonazepam, etizepam, flualprazolam, flubromazolam, and diclazepam in Schedule 1 of the Controlled Substances Act to limit access to these substances. However, bromazolam remained unscheduled, and as a result, in 2023, bromazolam became the most prevalent designer benzodiazepine detected, surpassing clonazepam, which is detected via its metabolite 8-aminoclonazepam. In 2024, bromazolam detection showed a slight decreasing trend, and although bromazolam remained the most prevalent designer benzodiazepine for most of the year, clonazepam detection increased toward the end of the year and even exceeded that of bromazepam in November and December. Despite this, bromazepam remained the most prevalent designer benzodiazepine in 2024 based on annual positivity. The positivity of other designer benzodiazepines detected in 2024 is shown here. Designer benzodiazepines with less than 10 detections in the year were not included in the graph. After bromazepam and clonazepam, the next most prevalent designer benzodiazepine was atezolizumab, shown with its metabolite in shades of dark blue. Now, although showing an increasing in positivity mid-year, it ended the year with a similar positivity to the beginning. Now, flubrorazepam metabolite, 3-hydroxyflubrorazepam, shown in orange, had an annual positivity approximately half that of atezolizumab and was the next most prevalent designer benzodiazepine in 2024. Flualprazolam and metabolite positivity, shown in green, was greatest in Q1 and Q4, but its mid-year positivity was often not even half of that. Indesmethyl-adnazolam detection in red fluctuated, but it was detected in every month, whereas desalkyl-gadazepam, shown in purple, was sporadic, mostly being detected in Q4. Parazolam, shown in light blue, was added to Aegis testing in April and was detected for the remainder of the year, but at somewhat low positivity. The prevalence of the top synthetic cannabinoids detected in 2024 are shown here. MDMB 4-EN pinaca, mainly via detection of its butanoic acid metabolite, has been the most predominant synthetic cannabinoid detected at Aegis since at least 2022, and it remains so in 2024. In April of 2023, the Federal Register issued a notice of intent to temporarily place MDMB 4-EN pinaca in Schedule 1 of the CSA. However, this has not yet seemed to impact its detection, as its positivity, shown in green, was greatest in Q4 of 2024. MDMB anaca, shown in yellow, is a synthetic cannabinoid precursor that can be used to make several different synthetic cannabinoids, including MDMB 4-EN pinaca. It was added to Aegis synthetic cannabinoid testing in April and became the second most prevalent synthetic cannabinoid detected in 2024, and it was often detected with MDMB 4-EN pinaca. Now, the prevalence of other synthetic cannabinoids detected in 2024 is shown here. Synthetic cannabinoids with less than 10 detections in the year were not included in the graph unless they were related to another compound with greater positivity, for example, a parent drug with a more prevalent metabolite. So 4-fluoro-MDMB butanaca and its metabolites represents the third most prevalent synthetic cannabinoid detected in 2024, with the NBA metabolite shown in periwinkle blue accounting for the majority of the positivity. 5-fluoro-MDMB pinaca and its metabolites, shown in purple, were the next most prevalent synthetic cannabinoid, mainly via detection of the M7 metabolite, which increased significantly in Q4. ADB inaca, shown in red, and MDMB butanaca and its BA metabolite, shown in dark blue, were added to Aegis testing in April and were the next most prevalent synthetic cannabinoids, with ADB inaca having slightly greater positivity. ADB butanaca and its metabolite in the pink were the third most prevalent synthetic cannabinoid detected in 2023. However, in 2024, its relative prevalence decreased. Now, other synthetic cannabinoids shown here were minimally and sporadically detected throughout the year. The prevalence of synthetic stimulants in 2024 is shown here. Synthetic stimulants tested at Aegis include analogs of amphetamine, methylphenidate, as well as cathinones, which have been erroneously sold as bath salts. Synthetic stimulants with less than 10 detections in the year were not included in the graph. In 2022, pentalone replaced eutalone as the most prevalent synthetic stimulant detected. N,N-dimethylpentalone was added to Aegis stimulant testing in August of 2022, and since then, N,N-dimethylpentalone and its metabolite pentalone, which are shown in blue, have been the most predominant synthetic stimulants detected at Aegis, and this continued in 2024. However, uncharacteristically, their positivity declined significantly throughout the year. Now, the order of the top most prevalent synthetic stimulants did not change from 2023, as Eutalone, shown in red, was again the second most prevalent synthetic stimulant detected with greater positivity in the second half of the year compared to the first. N-cyclohexylmethylone in pink was the third most prevalent, and other synthetic stimulants had low and somewhat sporadic detection. Now, the prevalence of hallucinogens and dissociatives in 2024 are shown here. 2,4-deschloroketamine and its metabolite, 2,4-deschloronorketamine, shown in dark blue, first appeared in April of 2022. 2,4-deschloronorketamine became the most prevalent hallucinogen dissociative compound detected in 2022, and this continued in both 2023 and 2024. 2,fluoro-2-oxo-PCE is structurally similar to ketamine, but is not currently a scheduled drug. It was added to Aegis NPS testing in September of 2023 and was so frequently detected in the fourth quarter that it became the third most frequently detected hallucinogen dissociative compound. Now, in May of 2024, CFSRE released a public alert warning that 2,fluoro-2-oxo-PCE had been detected in recreational drug markets across North America. 2,fluoro-2-oxo-PCE in red was the second most prevalent hallucinogen dissociative compound in 2024. The third most prevalent compound in 2024 was the PCP analog 3-hydroxy-PCP, which was newly detected in the second half of 2022 and was the second most frequently detected hallucinogen dissociative in 2023. Its detection in 2024, shown in pink, was variable but displayed an overall decrease in positivity. Other hallucinogens and dissociative compounds had low and somewhat sporadic detection. Lastly, here are the top NPS detected at Aegis in 2024, irrespective of classification. Designer opioids were the most represented NPS class, followed by NPS other, which includes the most prevalent compound, xylazine. Designer benzodiazepines and synthetic cannabinoids both had 2 NPS representing their class, and there was 1 synthetic stimulant in the top NPS detected at Aegis in 2024. And that concludes our webinar. I'd like to thank you for your attention, but before we wrap up, I want to tell you how to get in touch with us for additional clinical support. The individuals pictured on your screen are my colleagues, the clinical scientist team of Aegis Sciences Corporation. You're welcome to direct questions to the phone number or email address on your screen. The information covered today is also available in written form on our website. Thank you for joining us today. I hope this has given you additional insight into NPS detection in 2024 at Aegis Sciences Corporation. Have a wonderful day.